now how we will be working with our adaptive reactions. Let's put it this way. There are two major types of adaptive reactions in the body, local and general. Let's say you have a challenge. Let's say some kind of staphylococcus entered a scratch on your skin. You got a scratch, bug got in. What would be the normal reaction of the body? The body develops inflammation around that scratch. What's the purpose of this inflammation, and is it good or bad? Inflammation is very good, because the purpose of that inflammation is to isolate the flesh-eating bug that creates pus. Well, pus is the flesh that was eaten by the bug. Right? We realize that. It's the cells that were destroyed by staphylococcus, which is multiplying in the tissue. So it's eating the tissue, creating pus. But around that pus, you will have redness and swelling, and it will be painful to touch. But that's redness and swelling, that's your protective barriers. That's why staphylococcus cannot become a flesh-eating bacteria and go all the way through your body, because the body quickly develops the antibodies, forms the capsule, encapsulates the bug. So staphylococcus cannot get through those protective barriers. These will be local adaptive reactions. So the pus is the pathology and staphylococcus, but inflammation around, it's your local adaptive reactions. We're getting that, right? Is that clear, guys? This is good. Like, we need those protective barriers. And the stronger they are, the faster the body forms them, the faster the body heals. Imagine staphylococcus got in, and your body is really well fine-tuned, adaptive reactions are great, so the barriers developed real fast. The body throws their leukocytes, it throws, everything there, and the barrier around that staphylococcus forms real fast. So what you will have? A little pimple. Maybe that's about it. Now, what if reactions are not that fast? And by the time the staphylococcus is doing its bad job and creating a lysis of your cells, the body is slowly forming those adaptive reactions. So by the time when they are formed, staphylococcus already ate quite a bit of tissue, right? Instead of little pimple, we will have what? A boil. Same process. It's the same basic mechanism. It's just size is different, because the reactions were slow and the body didn't have a chance to catch it in time. So boil will also heal, but it will already heal with a little scar, right? Because it's a big process and lots of tissue has been destroyed. So that's why we need to improve adaptive reactions fast. So instead of having a boil, we can only have a little pimple and get it over with. Got that? Now, if we have a boil, because staphylococcus is there and it's getting into the bloodstream and the body is not strong enough to create the local adaptive reactions in time, to protect itself, the body includes also what we call general adaptive reactions. Meaning entire system now will be creating the conditions to kill that bug. And in order to kill that bug, the body most likely will develop a fever, because high temperature kills the bugs. Viruses as well as any kind of microbes. So now, plus to local adaptive reactions, we will have general adaptive reactions, which will be fever, sweating, redistribution of blood flow in the body. We will have entire system involved in the process. So the difference between local and general adaptive reactions, right? For general adaptive reactions, we need the central nervous system involved, and especially autonomic nervous system, and our regulatory peptides. We do need that for general adaptive reactions. So we have, but this is a case of, let's say, acute problem. But we have the same very mechanisms for the chronic problem. So let's say we have some kind of pathology sitting inside. Maybe it's a stomach ulcer. It is a pathology. So pathology itself is the ulcer that has been, the tissue has been destroyed by whatever reason, for whatever reason. Now the body develops inflammation around that, which is our adaptive reaction, which is good. And that ulcer will be displayed on several areas of the skin. It will be displayed right on your skin over here. It will be displayed on your ear, somewhere else. It will be corresponding vertebra on the back. So there are several areas where your pathology displays itself. Now, stomach ulcer is a chronic pathology, meaning it's already energy cyst there. See, acute processes like inflammation, like boil or pimple, they don't have enough time to create really a cyst. It's acute process. It's get it over with. Energy cysts we form only when it's chronic, when the process is chronic. So stomach ulcer is kind of a chronic process. So we do have energy cysts sitting there. So our cyst has this protective barriers around over here, right? Several of them. And all of them are displayed on the skin in one way or the other. So we have our asymmetries on the skin. Now what do we need to do? We want to get to the pathology. In order to get to that, we need to break those barriers. Break the energy cyst. So we put our scanner on the skin. We start moving our scanner around, looking for those areas of small asymmetries, right, of the areas which are different. And we know when we find that area where scanner stuck, that's where your ulcer is reflected. That's where your ulcer is displayed. So what do we do then? We just leave the scanner there and let scanner do its job, because that's what it's going to do. It's going to break those barriers, because there is a direct informational connection now. So the scanner will be breaking the barriers of that cyst so we can get to the core of the issue. Now, how can you help with a laser? Laser is cascading. So laser you can put just beside, or you can put laser on a corresponding spot on the spine, because any organ in our body, of course, has a corresponding vertebra. So you can put a laser on the corresponding vertebra. You can put a laser on appropriate chakra. Or you can put a laser on a heart chakra and just charge all your chakras. It will cascade. So laser is easy. Scanner requires looking for small asymmetry and placing it close to the area where the pathology is. Finding that small asymmetry is your skill. That's how you will be working with local adaptive reactions. We will not be going now into the details how exactly scanner breaks the barriers. I can explain it to you, but it will require another 30 minutes of going into details how pathological system is formed and what exactly scanner is doing in order to break those barriers. For now, just get that what you are looking for on the skin are places where energy cysts present itself, where energy cysts reflects itself. And when you find it, when you put your scanner on it, scanner will be directly influencing energy cyst. And what it will be doing, it will be breaking the protective barriers of local adaptive reactions in order to get the process going and get the content of the cyst into the system, so the system can utilize the elements of that content and include them in a general dynamic activity. Because the body is dynamic, the content of the cyst is not dynamic, it's static. It's kind of a garbage can in a way. Garbage is sitting there rotting while the rest of the body is just changing. But as you break the barriers, now the garbage can be utilized somewhere else, recycled and cleaned up. But not by destroying it, but just including elements of it into other dynamic activity of the body. So we will be doing some exercise now, how we will be dealing with our local adaptive reactions and how we look for those small asymmetries and how we deal with them. Now, there are a few signs how small asymmetries display themselves. The most probably the sign that we like the most is the stickiness. Of course, when you move your scanner along the skin, especially scanner like a dove versus Cosmotic. Cosmotic doesn't stick that much, but still sticks, but not that much. Scanner as such as the dove does, and you can easily catch the stickiness there. So what are you going to do? You're going to ask your body. Remember, the body has several areas of complaint, and the body wants to deal with one at a time. So you have to concentrate on your body or on your client's body, because you guys will be working in pairs. So your client's body asks, what are the areas I need help with? Where are my complaints here and now? That will be your first question, right? What is that the body wants? Now the second question is, where is it? Locate it, because that's your intention. It's a power of intent. You're directing your mind to the area that needs help. So you start thinking about it. The better if you close your eyes and you concentrate on your body, on your condition, and ask your body, where is that your body needs help? You can select several places, then you have to make a choice. And in order to make a choice, try to assess your complaint, grade it on 0 to 10. 0 being nothing, 10 being unbearable. How strong is the complaint? Most likely pain. How strong is pain in my neck? Well, 3. How strong is pain in my stomach? 5. How strong is the pain in my tailbone? Maybe 7. Then you know. Then you know which one to start with. And then you will take your scanner and go with the place of the strongest complaint, correct? And we'll start looking in the area. Stickiness is not the only sign. You may find your small asymmetry can display itself as a change in color after a little while when you're working with a scanner, just somewhere in the area. Remember, you may not be able to locate your complaint always very accurately. It will not be always possible to just point it, it's here. Sometimes the body reflects the pain. Sometimes pain is there for so long that you kind of lose track of it and you don't even know what hurts anymore. So you only can have the area, general area. It's somewhere there, but you can't really locate it. That's okay. You just start working on that entire area with the scanner. Let's say it's my low back or it's my upper back, somewhere in my neck. So you will just start working along your neck. After a little while, the pain will concentrate. Then you will be able to locate it. But in the beginning, just start working all over, somewhere in the area. And somewhere in that area, you may find sticky spots, or you may find spots that are oversensitive. Like skin all of a sudden gives you that sensation, ooh, it's more than other areas. That sign too. Or it's less. Some areas may be totally numb. Is that a sign? Absolutely. Any sign that is different, not necessarily just sticky, different. It can be red or pale, sticky or non-sticky. Maybe everything else is sticky, but this particular spot is not. Also small asymmetry. Some areas will display shaving sound. Most likely you will have like a, when you run dove along the skin, a dove creates some kind of a shaving sound, like zzz, right? On some spots, sound becomes louder or dumps. Difference, difference. Look for any difference. And the smaller in size is the difference. As the most and the more intensive, the better for you. So that's how you'll be looking for those areas. When you found them, just stay on it. That's all you need. But your skill is to locate it. Where is that my energy cyst is displayed the most? The place which is the smallest and the most intensive, it means there's the most direct route to the cyst. So that's what you want. Another thing, if you have already changes on the skin like rashes or hives, that's really good because it's already, your cyst is screaming, I'm here. Okay, so that's how you will be looking for it. And you will be doing it like right in a minute. Let's say you experience some kind of pain somewhere in the upper back area. So you take your scanner and you start moving general direction from the top to the bottom, from a left to right. So like this. Going, right? So you're going from the top to the bottom, to the left to right. And you do it several times until you get your smaller symmetry. When you found it, it will most likely be area of stickiness. You just put your scanner there, that's all. And wait until it doses. So that's kind of a general approach. Anywhere on the body, same thing. General principle from top to the bottom, from left to right. You don't have to do it if you forgot it. No biggie if you forgot. But it's just faster. It will be faster. It's called a vector. So general vector in scanner therapy is from top to the bottom, from left to right. You can help with your laser in another hand. You can do the same thing. With a scanner, you're going from top to the bottom and you follow with your laser. Same thing. Or with the both hands. Any way, shape, or form. That's basically the same thing as just showing you two small asymmetries. So you will be, you can find two of them, one in one area of pain, another in another area of pain, and you will be working with both, starting with the one that is higher on the grade, right, where the pain is stronger. So don't forget, assess the complaints, concentrate on the complaints, select how many, grade them, and start with the strongest. Okay? Now, that's another area where you will be going, because working just on a complaint itself may not be enough. Next area what you want to work with would be areas what we call reciprocal zones. Reciprocal zones. Reciprocal, it means symmetric. And remember we talked the body is symmetric in several different ways. It has a vertical symmetry, right, left, horizontal symmetry, up, top, bottom, and also front, back. So not to forget, just imagine this Da Vinci's man, right? And that's where would be reciprocal zones. Let's say Da Vinci's man has problem in his in his left palm. So his reciprocal part would be the other palm on the other side. It will be right foot if we consider vertical and horizontal at the same time, and it can be back of his, like if this is front, it can be back of his palm. So there are several different ways where his problem can be approached, and another symmetry would be on the right hand side, top to the bottom, right? So if I have a problem with my let's do a little exercise. I have a problem with my right knee. I will treat my right knee, but besides, what else I will treat? Left knee, because it's vertical symmetry, left knee. If it's horizontal symmetry, top, bottom, what? Right elbow, right? Back of the knee, front, back. And also left elbow, because if we imagine a cross, right? So my right knee, we can treat left knee, left elbow, right elbow, and the back of the knee. Correct? If I have a problem with my thymus, C7, right? Front, right, and my tailbone. Correct? Good. Stomach. Stomach's kind of in the middle, right? So that's the only place you go with your stomach, right? And of course, neck and shoulders, our reproductive organs. So we have reproductive organs, always treat neck and shoulders. And of course, tailbone, because that will be front, back. So you got that, right? So always remember that cross and front, back. So these are other areas to treat besides the area that you will be treating directly.
What about liver for top?
Yeah, well, what about liver?
Okay, so you know where it is on, you can go around to the back.
Correct.
But where is it on the top? Yeah.
Liver will have representation on the spine.
Yeah.
But that's about it, because it's on a kind of in the middle.
And it's right in the middle.
Yeah. So you go about T5, T4, T5. Guys, we're giving you just the general guidelines, but body is so individual. You will find areas which you can't even connect to anything. And yet, the signs that we will be also working on, it's something that comes out during your treatment, wherever it comes out on the skin. Let's say you're working on whatever, you're working on the elbow, and all of a sudden the red spot on the left shoulder comes out. We have no idea why it's there, but the body is bringing it up, means go for it. Whatever the body brings up, go for it. It's screaming at you. Just listen to the body. Forget the rules. Just listen to the body. Okay. So that's how we basically work with the local adaptive reactions. And one of the most common techniques of working with the local adaptive reactions is called point of pain. It's basically what we already know. So you just go, turn the device on, set the level, energy level somewhere away from the area you will be working on, and then start looking for the, small asymmetry in the area where the point of pain is, if client can locate the point of pain. If he cannot, it will be other approaches. Now we will treat the point of pain. We will treat the symmetric spot on the other side, and we will treat the corresponding vertebra. Okay? For every complaint that can be located. Now for, let's say, liver. For liver situation, if a client has a pain in the liver, we will treat the liver. We will treat symmetrical point on the other side, and we will treat corresponding vertebra on the back. Right? Clear? Yeah. Okay. If we have a sore throat, what are we going to do?
The ring.
The ring! If I would have a little prizes, I will give you a prize. The ring. The Pirogov's ring, absolutely. Because it covers everything. Because that's the symmetry, right? You can have, if it's a tonsils, you will have the symmetric part on the other side. What's the point to go 1, 1, 1? Just go there, do the ring, cover the whole thing. Of course. So that's point of pain. That's a technique, guys, I suggest you do right now. Okay? On each other. It can be other element into the point of pain technique. We only were talking about the static pain, which a client experiences all the time. But pain may be coming up only in function. Maybe there is no pain if client doesn't move the shoulder. It only comes out if the client starts moving the shoulder, and that's only pain comes up. Now we add, in this situation, to the point of pain technique, we will add working in motion. You will perform point of pain as we do. Let client move his shoulder, locate where the pain is, treat the pain, treat symmetric part, treat the corresponding vertebra. But after that, let him move it. Let him do it in function. And keep your machine wherever the pain will be radiating at the moment of the movement, okay? So you will be doing the point of pain technique, but with range of motion. Okay? So creating the release and range of motion, because our agenda is to completely restore the function. Don't forget, don't check only complaint, check also function. Because function is more important for the body than the structure, than the pain. But that's what the body is concerned with, is the function. So before you even start your procedure, of course assess your complaints, but also check the function, if you can.
Doing that, does that eliminate the north, south, east, west thing?
No, it doesn't. Because when you found already, I'm just not, it's too much to give, but it's not that important. But when you already got the small asymmetry, there is a certain way of working with asymmetry to eliminate it faster. And you don't have to do it. Sometimes you just brush through it and just get it off. But in order to get it faster, there is a certain algorithm of working with the symmetry. Like you brush it from the top to the bottom, from left to right, from right to left, and from bottom up. So this way, this way, this way, this way. And same amount of strokes, 3, 5, 7, whatever you decide. It's not necessarily for you guys. Don't even get into your head. If you know it, fine. If you don't, just work with the symmetry in order to eliminate that. And for Cosmotic, it's not an issue anyway, because with Cosmotic you will be just keeping it on one spot. With Dove, you can brush or keep. It's either or. So yeah, and so you will be working with the complaint in a motion.